They'll find something.
They'll find something.
I thought I knew, but I had no idea. She tried for the girl twice.
You do your plastic surgery.
It's just the way I feel like we need to talk about everything.
Everything.
Culture.
Yes.
It's all about culture.
I'm so excited. So today I have with me Dr. Chike-Obi. He's a world-renowned board-certified plastic surgeon, the owner of 360 Plastic Surgery right here in Austin, Texas. Thank you for being here with me.
Thank you so much. Oh my God, thank you.
How are you
Very
doing?
honored. I'm doing great. I'm doing good. Thank you so much for your time. This is a great platform you've built and are building. I know what it's like to build something, and so I really appreciate being a part of this.
Well, thank you
And
very
I
much.
to dive into all things culture, plastics.
Yes, we'll get right into it. I'm excited to have this conversation, and I'm gonna start by asking you, where did you do your primary school?
Yeah, so my primary school was started and ended in Nigeria.
Okay.
There's a town called Ilorin, which is in
Got it.
Kwara State. So if you go from Lagos northeast,
Okay.
2 hours by road, you hit Ibadan. Keep going, another 2 hours, you hit Ilorin. So it's kind of centralish Nigeria, not quite as central as Abuja.
Okay.
But I went to school that my dad was at the university as an academic. So that's why we were in that town. The town was basically a bit more than a university town, but largely that.
Okay.
So that's why we were there.
Okay.
And so I went to the school. The university had a primary school that I was attached to it, that I was a part of.
Okay. Interesting.
Yes.
Do I have it right that you did your undergrad at UPenn?
Yes.
So
Yes.
how did you make the transition from Nigeria to the States?
Philadelphia, right?
Yeah.
So the longest story is I was born in the U.S. Actually.
Okay.
When I was
sense.
about 3,
Okay.
when I was about 3, my parents finished what they were doing in the U.S. They were going to school,
Okay.
and they moved to Nigeria. And so I grew up in Nigeria until around high school, early high school. They decided to come back to the U.S., and so we all came back as basically immigrants. You know, with now 2 brothers, younger brothers, and myself.
So 3 boys.
3 boys.
Oh, wow.
My mom suffered.
Your mom's done
She
good.
suffered. She tried for that girl.
Oh.
I like to say she tried for the girl twice after me.
Yeah, I just have
But
to mention
maybe
something
it's 3
here.
times. Yes.
My mom tried for the boy, so we were 6 girls, then a boy, then another girl.
Okay.
So your mom did
6. Wait, hang on. There's 8 of you?
Yeah.
Are you serious?
And then I have a bonus brother.
Wow. That's a big family.
Yes. So she tried for the girl. My mom was trying for the boy.
Wow. That's fantastic.
She got 1.
Where do you place in yours with your siblings?
I'm 3. My sister is 1.
Okay. So
Yeah.
she's the first.
She's the first.
Oh. Okay. Ada.
Yeah, the
Naya.
family. Yeah.
Naya.
And where are you?
So I'm first.
You're okay. There you
to be
go.
honest.
Yeah. So. Interesting.
Yeah. Okay. So we all came back to the U.S.
Okay.
To Chicago.
Oh.
So
Okay.
I finished high school there, and you asked about UPenn. So
Yes.
I always had this draw to Philadelphia because I was born in Philly, but I didn't really know it because we left when I was 3 years old. So I'd kind of romanticized the idea of Philadelphia. And then I discovered when it was time for college, there was a school there called Penn. I researched it. It seemed very attractive to me. At the time, I wanted to be a physician. I liked, the sciences and kind of the usual story for someone with a physician parent.
Yep.
My mother's a physician, so she really, she was a pediatrician for a long time.
Okay.
And then she ended up becoming a neonatologist,
Oh, interesting.
which she does now. But she
Nice.
inspired me from a young age to want to take care of people, actually. So I had that inclination of medicine.
Okay.
I discovered Penn, and then it being what it is, a very strong pre-med program, strong medical school, and being in Philadelphia, I just really wanted to get there at all costs. So I tried everything I could possible to make it into to school there, and luckily that worked out.
Excellent.
So I showed up at Penn for college.
Okay.
And-
Residency.
well, so with college is Penn, and then I actually in the probably the same in Canada. I'm not sure, but for us, you do 4 years undergraduate,
Yeah.
and then you have to do 4 years medical school separate.
Well, we don't have to do 4 years, but I mean, some people do 2, some people do 3.
Yeah.
Yeah, and then you
you
apply
go
for
to
med school.
Yeah, for us, you pretty much have to do the 4 years.
Oh, really?
Pretty much. I think the ways you can get around it, some programs that are accelerated,
Okay.
where you come in and you do like a 6-year thing.
Oh.
But there's like few and far between. I'm very competitive. Most people do an undergraduate degree.
Okay.
And while they're doing that, they apply, they do the MCAT, which is an entrance exam.
Yeah.
MCAT, and then they go into medical school. So I went through all that, and I basically, I liked Penn so much. And I kind of had this idea of like, the med school was like very strong. At the time I was going through, it was the second med school in the country.
What was the med school called?
Penn, UPenn's medical
Okay.
school. And it's actually the oldest medical school in the country. The very first one.
Really? Okay.
Benjamin Franklin set it up, like when he showed up back in
Really?
the day. Yeah.
See, I'm learning
So,
American history here.
The history is very strong, especially on the East Coast. So for me, I was already at Penn. I'd had made some inroads with some faculty with research I was doing, and even just clinical work that I was being exposed to as an undergrad. So it just made sense to stay if I could. It wasn't a guarantee by any means because it's quite competitive, you can imagine.
Yeah.
But for me, luckily that worked out too. Fortunately,
It wasn't
I
luck.
stayed on.
I don't believe in
Fair enough.
hard work.
Fair enough.
Work, yeah.
It was a lot of hard work, and
Yeah.
Penn is competitive. Like,
Yeah.
I mean, the quality of
You
people
earned that.
you're
You
competing
earned
with.
your right to be there.
Yeah, yes. I mean, the people you're competing with, even undergraduate for like these pre-med classes,
Yeah.
it's a pressure cooker.
Wow.
'Cause they're from all over the country, all over the world.
Yeah.
The best of the best of the best. So that's one of the things I drew from college and medical school. I'll never forget, we had Ben Carson came and talked to us one year.
Okay.
And he just, to me, I was like, wow, this place has people of this caliber, physicians, surgeons, world class coming and being exposing us to this. I feel like the biggest benefit of being a place like this, like Penn, was the faculty are great, the history is great, but really I think it's the people, your peers who you come in with, because it draws from all over the world, like I said, and everyone is like a go-getter, they're bright in some fashion, and so it just makes everyone like a sharper version of themselves.
Nice.
So I definitely benefited from that, and I'll never forget that experience.
That's nice.
Yeah.
Okay, I love that. And so where did you do your plastic surgery?
All right, so I finished. So when I was at Penn,
Okay.
so when you get into medical school, some people know what they want to do exactly, or they think they do. I thought I did. I liked cardiology. I thought it was amazing.
You too. Yes. I want to know why you didn't do cardiology.
Sure.
I didn't do cardiology.
Sure. So I like cardiology. And why did I like cardiology? I mean, when you show up in medical school, compared to like now, when you look back, you think you know a lot, and you do, but like it's really kind of a tiny amount of like what medicine actually is. But I came in with this preconceived idea of what cardiology was, what I wanted to do. As I went through the curriculum at Penn, I discovered anatomy, which kind of blew me away. I was like, wow, this detail, this intricacy that we take for granted.
Yeah.
But like just seeing all that, I'm sure you had a similar experience.
I mean,
Right.
yeah, absolutely. I mean, that's why I'm a radiologist.
Yes, yeah, which is, I mean, it's
Kind of ties
all
in,
anatomy,
sort of.
all
Yeah.
anatomy. I mean, well, not all, but a lot of it is
Yeah.
anatomy.
A lot of it is anatomy.
And that detail, and anatomy is just such a fascinating thing. It's
Yeah.
like, what is anatomy? It's relationships.
Yeah.
Actually.
Yeah.
It's not just structures, but
Yeah.
it's like structures as they exist next to other structures and what that looks like. So it's a microcosm of, I think, just kind of human existence.
Especially as it relates to the heart, too. The relationship of, I find
Yeah.
the heart fascinating.
Yeah. And how it's very fascinating. Very
But I
much
didn't
so.
want to do internal medicine.
Yeah, no? Why not?
Oh my God. No. I just feel like with internal medicine, if there's nothing wrong with you, by the time they're done with you, they will
Something will be. They'll find something.
find something wrong with you. And then
Or if you're cynical, they'll cause something.
this is what I'm saying. And so I thought to myself, as much as I love cardiology, I can't do internal medicine. And that was it.
Yeah. And then we can talk a lot about like just medicine in general, and like, and I want to hear your thoughts and my thoughts on medicine.
Yeah.
It's endlessly fascinating. All of it is fantastic, essentially.
Yeah.
I think that, we'll probably get into why plastics in a bit.
Yeah, I want to know why plastic.
Yeah,
Like, how did
yeah,
you,
yeah.
especially as a Nigerian, you
Yeah.
think heart surgeon, cardiology.
Yeah.
You know, when you told your dad, if you did,
It wasn't easy, by the way. Like when I brought this up, I was going to do plastic surgery. It wasn't easy with that.
Well, that's precisely what I'm asking. Like, what did he say? What is so? I'm so curious to understand, to hear. Why did you think of plastic surgery?
Yeah.
What did your parents think? Your dad in particular?
Yeah. So basically, it's a medical school. So I started to discover things, and I was like, it was almost like a souped up version of like college, where I was like, okay, wow, I thought I knew, but I had no idea, because here's anatomy, here's, even pharmacology.
Yeah.
Everything was like not brand new, but the depth in medical school and the rapidity of like the information, to me, was like, whoa, this is crazy, it's awesome. And at Penn, we had this curriculum where we started clinicals early. So we started clinicals after a year and a half of didactics. In most programs at the time, you do 2 full years of didactics and then clinical. So that early exposure was, I think, huge, because you're asked to determine like what you're gonna do for the rest of your life, and the more time you have to like feel things, I think the better.
Yeah.
I did surgery as a required elective, and I didn't really think I would like it. In fact, I was like, let me just do this first and get this over with, because I heard it's terrible, and like the hours are long, and like people are like, they're mean to everybody.
The things you hear.
But I showed up, and it was thoracic surgery first. I did first, and it wasn't a choice. It was a required rotation. But I loved it.
Oh, good.
I stayed up forever. Like I got up early. I loved all of it. And there was a surgeon at Penn at the time. I think he's at Stanford now.
Okay.
And I was saying by name. His name is Joseph Schrager. He was the chair of like thoracic at the time at Penn, and I was on his rotation. So I'm in the OR with him, and as a student, like this is brand new. You just want to not screw it up, not get in the way. Like even if you cut suture, you're lucky, and you don't mess that up, you're lucky.
Yeah.
So because you're brand new at this. And there was a resident at the time. His name was Seamus Carr, a military guy, real nice guy. But we're doing these cases, and it was like just such a great environment, a lot of camaraderie, intense. It's thoracic surgery, but I just felt like it was just such a great endeavor, amazing. And then you do this thing, and then the patient is better, and it's palpable, and it's visible. And it's like you can see it right away, and all that was just like it just blew me away. And then I was further blown away when there was a day I was in the OR with Dr. Schrager, and he's one of these people, like at the time when you look at someone who was like in the field, he was someone you want, he was an inspiring figure. He was a very gentlemanly.
He older?
He was.
Was he older?
Yeah, he was. At the time, it was probably like maybe like deep early 50s maybe.
Okay. Yeah.
And I was like in my 20s, right?
Yeah.
But he was just kind of impressive person.
Right.
But one day we were in the OR, and he just looked at me. He said, "So what are you planning on doing?" And I was like, "Yeah, I'm looking around." I mumbled something, and then he goes, "Well, you ought to consider a career in surgery." And I was like, wow. So because of the kind of character he was, that actually made an impression on me. And I was like, maybe I should consider career in surgery, because maybe he saw something that So that was, and I already liked it. So I just pivoted everything towards surgery, and then plastics came about because I did an elective rotation with the plastic surgeons in Philadelphia, and I saw some amazing things. It was reconstructive work, but that was crazy.
Yeah.
But long story short, once I discovered plastic surgery, that was almost the end. Yeah, I fell in love. Yeah, I fell in love. To me, it became, I saw it as the kind of the pinnacle of and I don't say that arrogantly. I think medicine is like an amazing thing. It's infinitely amazing. All of it is amazing. But I do believe that it's such an intense endeavor. Like you're a radiologist and you chose that, and I'd love to hear that story too. But I think it's such an intense endeavor and an immersive endeavor that I think everyone should be able to feel like their space is the best in medicine, or the most the pinnacle, and should be willing to debate that with anybody else.
Yeah.
Like I'll sit with anybody in medicine and debate why plastics is the pinnacle, and I hope they do the same for their specialty. Yeah. And that's the beauty of this, because anyone who's in the wrong space, I think, ends up disservicing themselves and their patients, because they probably won't bring 100% to this. It's not like being, it's not like being like in some other space where not to do, something that's not like medicine is a sacred endeavor. I feel like there are others that exist, but medicine is one of them. And so the ideal is when someone is like where they want to be and need to be, and this goes into advice for people who are coming up. You asked about that. I see them with some frequency. Many students of color will find me, identify me, because there's a paucity or a lack of mentors for people who are black students, Nigerian background, or just black students, period. So they see someone like you, for sure, me for sure in Austin, they reach out and I bring them in, and so they ask for advice. So I've had to think about how I would have advised someone going into medicine now, not necessarily plastics. And if it's like, is it even a good idea? You hear this back and forth. Is medicine good? Is it bad? Is it people getting? Is there so much burnouts? Is there so much? This physician like drug dependency. There's like suicide issues. So it's a very tough thing, but the world needs great doctors.
So what do you while we're on this topic, what do you tell them? I'm curious as to if somebody wants to get into medicine.
Yes.
Especially with, I would say us as Nigerians, right? So you got to be a doctor, a lawyer, but
it's funny. I always
a doctor, not just a PhD, but an MD.
Yes.
What do you say to people when they ask that question? Because I know what I say.
Yes. That's the funny thing. It's like if you're Nigerian, with a typical Nigerian family like mine, for example, like you have 4 choices of what you can become. You can become you can become a doctor, you can become a lawyer, an engineer, or you can become disowned. Just your option. 1, 2, 3. Or pack your bags and go.
To my dad, we would all be doctors. It's like, come on,
Yeah. So I chose medicine, but I finagled my way into something that was like a little bit atypical.
Yeah.
No, so with people who are coming up, I saw a young lady from UT recently.
When you said UT, I was thinking Toronto, but you probably mean Texas.
Yes.
I'm in the States.
Yes, she's skilled person in Austin. So if they're in college,
okay,
I think that medicine is it's a great thing, it's the best thing, I think, but it has to be I think it needs to be a passionate decision.
Absolutely.
I think it does need to be that way. You say, okay, this is I've explored enough. And it's impossible to know when you're college age to see this full breadth of what exists. But I've seen enough that I know that I want to do this and commit like decades to this. I think that's really important.
Yeah.
So, not necessarily like follow your passion like in a trite way, but I think it needs to be an impassioned decision. Like, I don't see anything else.
Yeah.
That's as credible and important for me.
Yeah.
That's what I ask people to look for. But really what it comes down to, Dr. Ife, Dr. Ife is that I've played Dr. Ife, I think. I think it comes down to like the more you know yourself, the better you can make that decision, right? If someone knows themselves really well, then they can say, okay, this is what will make me fulfilled. Not necessarily happiness. I mean, happiness is a very elusive thing for many of us. But I think fulfillment is a much more concrete goal to say, okay, if I do this on a daily basis, will I be fulfilled with this work that I'm doing? If the answer is yes, then I think medicine is a great choice. Yeah. And then it becomes, and then the next complex thing is what within medicine, because medicine is, as we said earlier, is this wide. There's so many things. There's so many. Yeah. It's like a beautiful tree with many beautiful branches,
right?
That you can take and choose, and depending on like your passions and then your, I think, inclinations and like your strengths, that matters a lot. I think.
No, I'm glad you said that, because to me, I think it's very important that you absolutely love it. It is hard to know yourself really at that age,
Mm-hmm.
But especially in this day and age, medicine, it's so hard, it's rigorous. People are looking for something quick and easy, right? Sure. And like you mentioned, you're in this day in, day out. You've got to love it. And if you get into it and you don't love it, don't stay in it because your mom and dad want you to be in it. Mm-hmm. You can always pivot, right? It's got to be an absolute love. Yeah, because people think, oh, I started this process, I have to stay in it. No, I just think long term. You have people that change careers in their 50s.
Yes.
Right? So I just feel and I also think these are people that are going to be taking care of us. And so I want to make sure if you're going to be in this, love it.
Yes.
If you live and breathe it,
Yes.
it's good.
Yeah. Yeah. No, absolutely. I think it's very interesting what you said. I think pivoting is good to know when to, if it's not going to work out.
Yeah, like it's okay. You can pivot.
Yeah.
Yeah. Know when.
Yes. And the flip side to that is like, okay, so when do you make a call to pivot versus when do you say, okay, I need to persevere through this? And I think that also comes from knowing like yourself.
Yeah.
And understanding if you're going through a tough patch, is this a rough patch along my path to glory? Or is this an impasse? Say like, well, like, okay, if I like, it's tough and I love it, let me push through. It's tough and I've come to hate it, then you pivot out.
Yeah.
But I think that really comes, it's an individual choice. It's almost like with surgery, like when I had a patient today, I told you. So it's a cool story. So she had we did it's a breast augmentation, and we did some nipple inversion correction.
Right.
But I met with her and we'd spent a couple of hours at our consult talking about what she was looking for.
Okay.
And this is a kind of routine in my practice. It's longer than most people will spend in a consultation. But I think I've come to realize it's just the way I feel like I like to do it, and I think I get closer to the truth for any one patient that way. Nonetheless, some people need more time than that. So I took a trip to Africa with my family, Ghana and Nigeria, and so she asked some more questions while I was away, basically. And we tried to fill that abroad, and I offered to talk to her like over the weekend when I got back into town. She said, no, I'm good. Okay. But this morning she had like a lot more questions. And so we spent a lot of time talking about everything. And I was like, listen, it's what she needs.
Yeah. I love that because it's not common to find surgeons who want to spend time with their patients and really listen. And of everything I've seen about you, I found that stood out.
No, that's
I know
kind
that
of
you really, no, it's the truth, that you really spend the time. And it reflects in the reviews as well.
Oh, thank you.
With your patients and to listen, because plastic surgery isn't something that you just want to go into on a whim, right? There are a lot of questions to ask and things to consider.
Yes.
So,
yes. I think all surgery is this way. Well, most people plastic surgery is unique in the sense that among surgical specialties, that people are coming and they're not, sick, right? So if someone has... if someone has like, let's say I have like appendicitis or, like God forbid, like a tumor, then, or a cardiac issue, then I'm like in a different state of mind than someone who is otherwise just went to the gym and says, I want to get XYZ done to accentuate what I have going on or to optimize or to highlight or to that kind of thing. So I think that comes loaded with a lot. There's a lot we can talk about that, but that person comes to surgery a lot of times with a different mindset where sometimes there's some anxiety with that because a lot of times I see a lot of mothers, for example, and fathers, but certain mothers, and sometimes they're like coming after family planning and they want to get something done, but they're scared of anesthesia. And there's some mom guilt as well, like, should I be doing this? What if something happens? So all that we work very hard to diffuse because as you may agree, I feel like what we do is profoundly important to society, profoundly so. And I think there's a lot of re-education that, on a large scale, that I think would be nice if we could do, where people don't feel guilty about dedicating resources to optimizing their body, the one body that they have. The body can be a paradise for someone, but it can also be a prison. For many, and I say this on the back of talking to thousands of people intimately about kind of their bodies, their insecurities, and then seeing them come out of surgery almost like different people, taking on the world on their own terms. It's a beautiful thing.
I do agree, and I wonder what you would say to why do you think there's so much judgment as it relates to plastic surgery?
Yeah, I think I think societal. So it depends on where you are, right? So we can talk about America or the West. Classically, you can say U.S. and Canada,
about Nigeria, and also North America.
We can say Nigeria, let's say, as a proxy for like Africa, which is a little bit presumptuous because Africa is a giant place with different cultures. But let's just say Nigeria. and then we can say like the US,
Right.
okay, slash Canada, and then we can say like a Brazil or like a South Korea,
Yeah.
and like look at the differences in this, because the culture in the end shapes a lot. Most things are downstream of culture. So you take anything and say, how is it used in a certain culture, and you learn a lot about what the people are doing and what they're thinking. So I think historically in Nigeria, Nigeria tends to be more conservative, at least outwardly. So saying things like, I'm going
Really?
to... Well, historically...
Wait a minute, I had to think about that for a second.
Yeah.
Like,
I think historically, so like, let's say like 15 years ago, someone would not get up at a dinner table and say, I had a breast aug. Like,
No,
look at me.
no.
In that sense, people don't want to share that.
True.
Right? In that sense, they want to keep it behind closed doors.
Right.
Tight lips. That is changing like massively.
Yeah.
Like, I saw a plastic surgeon friend in Ikoyi this trip, and he has a big practice, and it's busy, and it's in the middle of Ikoyi, and it's out there, and it's there. So it's changing, I think, and I think it's a great thing. But historically, Nigeria has not been like that, in my experience.
Yeah. No, you're right. When you said conservative, I think you look at, especially on social media, you look at all these Nigerian women, everything is so flashy, and just figure eight and
Right.
everything, right? And I think when we first met, I was telling you, I was talking with our tailor back home, and she was saying, I was talking to her about, getting dresses and everything and getting snatched, and she said, send me a picture. It's like, I sent her a picture. She goes, she said, you're built like a white person.
What?
And she goes, let me tell you the secret. She goes, it's all in the packaging, And so she said, people go in and get, not waist trainers, but the hip pads and the butt pads and everything. And then she said, but some people will do some, like stupid thing, like go under the knife or something like that. She literally said that.
Okay, in a negative way. Like,
oh, totally in a negative way. 100% in a negative way. And I was like, well, you know what? It's okay. Like, if people want to do that, that's fine, But that's still the mentality of a lot of people there. Yet, I think that is changing, isn't it? Like, so I'm interested to know what your experience was there. I think it's changing, but people don't like to talk about it openly still.
Yeah,
right?
it's changing for sure, but I think it's becoming more open. People that I interact with in Nigeria, a lot of family, some friends, the sentiment is that there's a lot more conversations being had about Botox, about wellness, about appearance. And this concept of Nigeria is a lot of body shaping is popular. So things like, okay, who's getting a BBL? Like, whose bum is real? That's the bum they say. Whose bum is real? Bum is real.
Yes.
Yeah, that kind of thing, at least on this trip, has become a lot more kind of has surfaced more than it used to be.
Yeah.
For sure. So I think that's a good thing. So I think if you look at like the US, for example, I think it's kind of in the middle. Okay, so Nigeria, or like classically Nigeria, changing, but used to be like hush hush.
Yeah.
No one knows, like, I'm gonna get it done. Let me travel abroad. Let me hide for a while. In fact, there was when I visited like my friend. He sees a lot of patients from outside Nigeria, and there was someone who
From where?
other countries outside Nigeria, within like West Africa, and someone who came who was like a kind of a celebrity figure who didn't want to do it in their country because they wanted to kind of keep it
Hush, hush.
from others. So they came into Ikoyi to have whatever done,
Interesting.
stay a while, and then go back home. So I'm delighted to see that changing, because I think that the body shaping, appearance is so crucial to the kind of, so mind-body connection is very complex, but I think there's so many connections there. And I think strong body, strong mind.
Yeah.
Absolutely.
Absolutely.
Yeah. So the US, I think, is somewhere in between. So people, we do celebrate kind of individualism, optimizing your life along different axes, including appearance, but other things matter a lot to us, like mental health matters, nutrition matters, wellness matters, financial health, so it is including appearance. So, and even the US is inching into a more open approach. Recently we had some celebrities stand up to say they had plastic surgery. People like Kylie.
Well, I was just going to talk to you about that.
Yeah.
Yes. Oh, my goodness. I actually did a post about that.
You did?
I did.
What did you write about it?
Because, people were asking, what did you get done? What did you get done? She finally said what she had done. And she was very specific. And then if you look at the comments, the trolls.
She had trolls?
Oh,
Really?
my goodness. You know, there was actually there was a Nigerian YouTuber who talked about her in such a negative way. And I think to myself, first of all, that family's hated, which I don't understand why people hate them. I love them. I think they're very ambitious and wonderful, you know?
Yes.
But I think she's told you what she's done.
Yes.
What's the problem? There's so much judgment. And I think you may not want to get a breast augmentation. Maybe you want to do your lashes or your hair, whatever the case is. It's okay. Like, it's a huge world. There's room for everybody.
Yes. Yeah.
You know?
I agree with
you. So why is there so much judgment? I don't understand it.
Yeah, I mean, I don't think we'll solve that today. It's a complex. Yes, it's a cultural thing. I think that there are people who embrace this idea of, like, you know, change, you could say.
Yeah.
Someone could say, listen, and I hear these comments, like, with some frequency. Someone could say, okay, so for breast surgery, I had someone come in for breast augmentation.
Yeah.
Real nice girl. She just had a UT. I think, no, she was out of UT for a while. She's 27 or so. We did a breast augmentation. It was very tasteful, beautiful. She was about a month out, came back into our clinic, and she made a comment I'll never forget. She was like, oh, I'm so happy. Like, I look really good. And, you know, you get it. So it's like, I'm like, it's appreciate. Thank you very much. Then she goes, no. She's like, you don't understand. She said, when I was 13, I was in a locker room.
Oh.
And someone said, you look like a boy.
Yeah.
And I've carried that for the past 14 years. Yeah. And now I finally can move past what was probably an off comment. But for her, she carried this. So that kind of color to plastic surgery, I mean, just it completely wipes out whatever troll or whatever, someone who doesn't understand, the uninitiated saying stuff on some platform. Yeah. When you see these things routinely, it just changes everything, and so you understand what it's about.
Yeah. And I think it's important for people to understand too, like, maybe you want to comment on the origin of the plastic.
Yeah, sure.
Like, you know, when people think of plastic surgery, I think they think of, you know, silicone and plastic. What is plastic surgery?
That's just it, exactly. So I think, I mean, that probably doesn't do us a lot of, probably does a disservice from a marketing standpoint, that the word has several meanings. It's true that, you know, if you take a Tupperware or something like this,
it's plastic.
You know, people, it connotes this idea that something is like manufactured or fake or flimsy or trivial or not real. And so that word plastic does mean that. For our specialty, when the name was decided upon, it's actually derived from, there's a Greek word plastikos, which means to mold something. And that's where, and this is from like the late 1800s, early 1900s, when some surgeons they created a space of reconstructive plastic surgery, at least in the US. And then we named the thing plastic surgery. And so that's where the name comes from. So it's really to what we do on a daily basis in our craft, which is to mold human tissue to deliver an appearance and a function that serves the needs of the person who asked us to do that work. But it has that mix with plastic. So in common speak, people will say, oh yeah, plastic surgery, because of that mixed, kind of a background of the term.
Yeah, I think that gives, it sends the wrong message in some ways, you know, and people forget that was the basis to form, to mold.
Most people don't know at all.
No, I know. So that's why I thought it's important to mention that. And I think that maybe you'll agree or disagree that a lot of the misinformation relating to plastic surgery comes from that.
I think that's a root of a lot of it. I think
social media too.
So all media even. So before we got into social media, I think whatever media from tabloids. Well, I'm sure I'm not sure, but even I ventured to say back when there was like a printing press. You know, when someone started doing, like someone would write about whatever it is. But I think the sensational is a lot more like eye-catching. So if someone says, "Oh, I had a facelift and it went bad," That's a great headline. Or I had some breast procedure and it went back. You know, there's a show called Bosch, for example. So that's so it's eye-catching. It's sensational. And so, I embrace all of plastic surgery. I think that, you know, the cosmetic stuff is amazing. That's almost all of what I do. But there's a lot of it that's not cosmetic, right? Even that delineation is a little problematic when you say reconstructive, cosmetic. I think it's helpful to some degree to say, you know, what's what. But ultimately, a lot of what we do is appearance surgery. And appearance surgery, I think, crosses over from a lot of cosmetic work, but also a lot of reconstructive work. You know, someone has a cleft lip, for example, and they can otherwise talk and feed, but they have a cleft lip, and a cleft lip is basically a defect or a slit of missing a tissue of the lip. Then most people would say that's not cosmetic, right? Most people would say a kid with a cleft lip, but it's appearance related for sure. No one's gonna argue that the appearance of a lip is that it should look like a lip. Right. That's and if not, they may get made fun of, they may get marginalized. So that to me is a useful way to say it is appearance related, because it cuts across a couple of lines, and it doesn't have that burden of cosmetic. The term cosmetic is, I think is great, but it comes loaded with this idea of like, oh, they don't need to do that. Or it's like, they're being vain. And vanity is a word that we can talk about and what that means.
Vanity?
Yeah, because people say that all the time, like, I'm just being vain, or that person is so vain they're doing this. What are your thoughts on the word vanity? How do you like to think about that?
I was just thinking, you know, it's interesting how you're mentioning appearance. Vanity, I mean, it's negative connotation
for sure.
Yeah.
That's what I don't like about that term.
Yeah, and that's why I don't like that term. I firmly believe that we should do what makes us feel good. I firmly believe that when you feel good, it has a huge impact on mental health. And what you put out there, you know, maybe you sit a little bit taller, you know, you walk a little bit straighter, you speak. Yeah, and I believe that if you are able to do something to get yourself to that point, you should do it. Yeah. I wholeheartedly
love that. I love that. Yeah, this word vanity comes up a lot, like in practice. Like people would even like joke about themselves and say, "Oh, I'm here, I'm vain. Like my sister is not vain like me. I'm here seeing getting this Botox or whatever." And vanity, I think, is a word that is unfortunate because it has this negative baggage with it. But the reality is that idea that we care about how we look, I think it's just a human condition. I think unless you live in a cabin in the woods and by yourself and you're a recluse, otherwise you care to some degree how you look, right? Even Buddhist monks, okay? If you show up and you want to join a monastery, and you walk in and you have jeans and a shirt and hair, you would not get in because your appearance isn't in line.
It matters.
So are they being vain? You could say that, but just the appearance matters. So we care about how we look because we want to fit in with something, either externally or internally. A lot of times it's like, I want to look the way I feel so I can meet the world on my own terms. Yeah. Very empowering. Yeah. Very empowering. And this is kind of the root of, you may ask me why I started 360. This is kind of part of that.
Yes, I do want to know. I do want to know that. For sure. But no, I completely agree with you. It is unfortunately a negative thing to say, but I think that people should do what makes them feel good.
I think that sentiment is, I think we all have that to some degree of like you got up today, you decided to like pick some article of clothing and not some other ones, and do your hair so not some other way because of what you're trying to do something with like the way you see yourself and the way and same thing with me. I was like, I could have worn like beach shorts today.
Totally.
But I was like, well, I'm meeting the famous podcaster today. So I can't do that, right? So you know, is that being vain? You could say that, but like that doesn't, it becomes a very unhelpful term because that negative energy it blocks us from having real discussions about what we're doing, you know. I think doing what feels good is great. I think that you know, everyone is subjective. What that means for any one person. Yeah. Appearance wise, I would say if you have some distractor in your life, right? Many of us do have we all have insecurities in some way, right? Something. if someone happens to have some physical thing that they see, that I call them distractors, where I look in the mirror every day, or I'm driving, or I walk by a mirror after I shower, and there's something that I see,
Always on your mind.
or not even always, but like enough that like maybe it's every day, every couple of days, where like it pulls me from whatever else I'm trying to enjoy, whether it's my kids or my spouse or my work, and I see that and it pulls me to like a negative place, and that thing is always coming up, then folks ought to be empowered to address it.
If you have the means.
If you have the means,
that's another
and you can
thing,
tolerate
the
the
means.
risk, because it's all risky. So surgery is risky, right? So
Yeah.
if someone says, "I don't want to get a rhinoplasty because it's risky," but they see they have a nose and like they see something if they don't care, then they're great. Life is good.
Yeah.
If it pulls you from where you are, and you want to have an optimized life, then I think it's worth looking into if it makes sense for you.
Yeah.
Of course, there's cost. Of course.
Oh, absolutely. There's cost. To that effect, how do you...
I want to try this drink that you got me. So we have a
good.
cucumber melon. This is
Raw.
raw. I've never had raw,
It's good.
but I do need hydration. I had surgery today.
Yeah, please drink up. It's very hot here, so I've been trying to stay hydrated as well.
It is hot. It's hotter than Nigeria, than Lagos, in Austin.
What was the temperature in Nigeria?
It was probably about 79, 80.
Oh, it's that Fahrenheit. In Canada, it was
Oh yeah,
centigrade.
yeah, this is true.
I'm
I
trying
gotta convert it. Which I think
I asked Siri before I came. I said, "What is 93 Fahrenheit?" And it's 34 centigrade. That is hot. So 79 is probably a little. That's a lot.
Yeah, it's almost mild.
Yeah.
'Cause I think it was. So here it was like 90, like a few days ago.
Yeah.
This is pretty good.
Yeah.
Should we plug? Should we plug them? Or no. That's not plug. If you pay us, we'll
Maybe
plug
I'll
you.
talk to them later and see what they say.
Sponsor the podcast.
Yeah,
guys.
exactly. That would be awesome. I think it's a US thing. And so before we move a little bit further, I kind of want to get your thoughts
Yes.
on plastic surgery versus a cosmetic surgeon.
Sure.
Okay.
Sure.
I've seen this on social media,
Sure.
and I don't think a lot of patients understand the difference.
Sure.
And obviously there's I don't want to call it a turf war, but plastic surgeons, rightly so, have gone through the training. And let's talk.
So in the U.S. anyway,
Yeah.
to say someone is a plastic surgeon means something very specific. It means you've gone through a certain path, training-wise. It means you've gone through, almost always, you've gone through a college, university. That's the first degree. Medical school, the second degree. You've had some training that is plastic surgery specific, that's sanctioned by the American Board of Plastic Surgery.
At least 4 years.
So in the old days, the path to that was usually after medical school, doing a general surgery
Okay.
residency,
Right.
classically 5 years, and then doing a plastic surgery fellowship for 2 years. That was the path for decades.
Okay.
And then, rightfully so, someone said, wait a second, why is, Dr. Ife in year 5 of general surgery, wants to be a plastic surgeon, why is she doing Whipples when after this year 6, she's going to be, she will never do it again.
More, yeah.
Why should she not be learning something that's like more specific to her specialty? So that went on for a while, and then ultimately there were these integrated programs where you would come out of medical school and do essentially 6 years, 5 or 6, of plastic surgery.
Okay.
Not the general surgery, and then
Pure
top.
plastic surgery.
Yeah,
right?
and year 1 is like an internship usually, which is mixed for most people. So, and all that's essentially ACGME is involved, of course, but ultimately the American Board of Plastic Surgery will say, are you a board certified plastic surgeon? And that board is one of 13 true boards, American Board of Medical Specialties. That includes internal medicine, there's like general surgery. There's 13 of them that are like boards that have been around for a long time. And so that's what plastic surgery is. And so that board certifies everybody. And I don't want to misstate the number, there's a few thousand people who are plastic surgeons in this country. Cosmetic surgery surgeon is a more open term.
Are they MDs?
If you say I'm a cosmetic surgeon or physician, then you have to be an MD or DO. A DO is a osteopathic medicine physician. There's two main pathways to become a physician in the US. The MD path is the allopathic pathway. The osteopathic.
That's a US thing. It's not a Canadian thing.
This is a US thing. So
Yeah.
the US history. This is part of the history of the US. So back in, I believe, the 20s, don't chat GPT me. You might get the numbers wrong. You can chat GPT my comments to make sure. But essentially, at one point in the US, there was almost a free for all in medicine.
Okay.
There were a lot of people who would show up, like, that guy who in general who did our podcast could say,
Very happy guy.
yeah, he touched that breast implant for the first time.
So happy.
He loved it. Made his day.
Yeah.
So he could call his uncle and say, hey, I found some, oil that I think is fantastic for healing, and I want to sell it and say I'm a physician, etc. It was almost a free for all. You could do anything. And there were 7 schools, paths of medicine, or 7 or so in the US. But there were a lot of quacks, a lot of charlatans,
Quackery.
and a lot of harm was done. So ultimately, there was a crackdown, and many of them were just like basically shut down on a regulatory level, and 2 were left intact. This is like in the 20s, I believe.
Okay.
And there was an allopathic school and an osteopathic school. The osteopaths have a more holistic approach to medicine than the allopaths, who have a more it's kind of a more kind of systems based, like diagnose, like, okay, like my chest hurts. Is it your heart? What's wrong with the heart?
Okay.
That's true. Oh, there's a blockage in the whatever LED or whatever right coronary. Let's give statin, whatever. So this kind of approach that we're all used to, that's the MD approach. The DO osteopathic approach is different. It's more kind of holistic, like some imbalance somewhere, like.
Is it more functional medicine, integrative medicine?
Kind of that approach, but something more holistic.
Okay.
I would say less evidence-based, but more holistic is the best I can say. So those two are valid, and someone could be a DO and practice today, or an MD and practice today, in any specialty, pretty much.
Can a DO be a cosmetic surgeon?
Yeah, so cosmetic surgeon, so yes, so that term is kind of broad. So anyone pretty much from any specialty pretty much can finish what they're doing training wise. They can tack on some additional training and present themselves as a cosmetic surgeon to the community. This can be done. There's state by state regulations on this, but it's certainly I would say less it's looser in terms of what's, and there's some great physicians who do great work, but it's definitely looser in terms of the definition of what that is. To say you're a plastic surgeon is a very tightly controlled thing. And you can't say it without having this training I'm talking about. But you can say I'm a cosmetic physician, certainly, cosmetic doctor, cosmetic surgeon, with little training tacked on to whatever your base is.
Can cosmetic surgeons do breast augmentations?
The breast implant companies, unfortunately, not to judge them, but they will sell to, I think, any physician who chooses to buy implants. There's one company that tried, maybe still does, that said they were focusing on plastic surgery only. But and there are general surgeons, in fact, who do breast augmentation in the US, or like ENTs who do breast augmentation. That happens. It's true.
Yeah, I think that's pretty scary. I think it's important that, as you were talking about choosing plastic surgeon, if you're going to choose one, to do your homework.
Yeah.
I wouldn't want to be going to an ENT surgeon, and I mean, they get trained exquisitely to do ENT.
Yes.
But not to do breast augmentation, you know. And I hope that with what we're saying here, that people do their homework and know that, even when you're plastic surgery rotation, you learn about wound care, wound healing, burns, all these things, right? This is not something that a cosmetic surgeon would know.
Yeah.
Right?
Generally, I wouldn't imagine that it would do
Exactly.
that unless they sort it out somehow.
Yeah. So it's important for people to know the difference.
For sure. And I think it's definitely incumbent upon, I think most people should, most people are pretty savvy. Not all, but people are pretty savvy. There's a lot of tools online to say, hey, a simple Google search would tell you what's going on with whoever it is you're assessing to take care of you or your loved ones. But I think that difference exists for sure in this space.
Okay, awesome. I'm glad you touched on that. Now, I got some rapid
You're
fire.
smiling. What do you got? Let me drink up and get ready.
I'm smiling, yes. Because now we're going to be talking about breast augmentation. Even though you didn't answer the question yet about what your dad thought about you going into plastic surgery.
Oh, dude. So, okay. So, I was saying, so.
I didn't forget.
Yeah.
I have a visual of your dad.
You are.
Saying,
Yes.
Chuma. Why?
You gotta realize. So my dad was. He didn't love the decision. So So this is the background. So my father he's MIT trained.
Oh wow.
So he's a physics.
Okay.
He's not a physicist, but he was like academician.
Yeah.
Akada in Nigeria. Say
Akada. Let's just keep it real. Akada.
Yes.
Yeah.
So he loves the sciences. His father before him was a mathematician.
Oh, okay.
In Nigeria, he did a lot in Nigeria back in the day. So my decision to not go into academics was, it was a little tough for them to take. When I was younger, people would say I had this nickname, Professor Chumis, for my grandfather. I don't know if it was wishful thinking or they thought I was like nerdy.
They were
thought I was a nerd or
You're
something.
gonna grow into the name. Okay.
Yes. But ultimately, I decided to not do that, and so that was tough. Even medicine was a tough pill to swallow for my family. My mom was fine with it because she's a physician. She got it. But ultimately, when I said plastic surgery, no one came out and said anything to me like directly, like, "Oh, what are you doing?" Because they've seen enough of my personality to know like I'm a serious person, and my decisions are serious and well thought out generally. So no one came out and said, "Hey, what are you doing?"
Yeah.
But I could sense there was a sense of like, Nigerians generally like, what you do is like a matter of pride for your family. So my son is like a neurosurgeon at the
Did they say
at the Harvard hospital.
My son is a surgeon. They're not really saying exactly what kind of surgery you do.
Yes. So there was some of that I sensed. But I'll never forget my mother has always been an undying source of inspiration and
Mama's love.
support and just her ability to be there but not be in the way, to support but not stifle, to strengthen but not suffocate. That really that's massive. So the amount of agency, and I try to do this with my kids. We have 2 young kids.
Okay. I was gonna say, do you have kids?
We have 2 young kids. Yeah,
Oh.
so a 9-year-old and 3-year-old.
Ooh.
So yeah. So Nigeria was tough because my 3-year-old is rowdy as hell.
Good for you for taking them.
We came back home the first day in Austin. He's like, "Dad, where's our driver?" I'm like, you're gonna be a problem. You're gonna be a problem.
Oh my god.
Boy, if you stop it.
Ooh. Yeah, it's a very different life here than
No, but so this idea of like agency for kids, right? So like a child is
I'm so laughing at that.
Yeah. Like a child is like, I try to think a child is not just like, it's not a static thing. Like these kids, like the future is the kids, right? So my oldest son is 9 and he's a 9-year-old boy, but within that 9-year-old boy is like a 20-year-old man, like a 30-year-old man, and a 40-year-old man. Like it's all there, not manifest. So I think understanding that and respecting that when we talk or like discipline him, to me, I think the approach is like that. My mother's gifts was whatever she was doing. It was always very clear that it was in my best interest.
Yeah.
And as Chuma, not like as her image of what Chuma should be. Does that make sense?
It absolutely does, but it's rare. Maybe
it's extremely rare.
It's rare. People ask me what would I have done if I didn't do medicine. I don't know. I didn't get to think. Right?
Interesting.
You
didn't get to think. Oh, really?
Oh no.
Oh, do you feel like you were kind of?
I don't feel. I know. My that was what was gonna happen. And did I resent it? No, because I didn't know any better. right? And so I went into medicine. Thankfully, I got in, and thankfully, I love what I do now.
Yes.
But with my girls, but my husband and I were like, do what you want.
Yeah.
It's about passion.
That's great.
Right? And you don't have to do medicine. If you want to do medicine, sure, whatever. And I think it's important. Hopefully things are changing back home a little bit. I don't know. And if not, at least in Nigeria, then parents that are Nigerian and are here and raising their children, with the exposure, they see so many different things. So it's like the world is your oyster. Choose and be happy and love what you're doing.
Yes.
You know what I mean? So with your kids, I'm sure they're going to be watching you growing up, and what we say has an impact in where we live has an impact on them, and they're going to make their choices.
Yeah.
And they've got to love it.
Yeah. I think that's exactly right.
Yeah.
Perfect.
Okay, cool.
Perfect.
Now,
So yes, so that was it. So with the family, just to finish that point.
Yeah.
So, but ultimately, it got to the point where I don't know, people just came along and understood, and they saw that passion that I have for plastic surgery, and then they see like my practice and like patients, and they get feedback from people, and then over time, I think people become converts too, right? So the classic one is someone says, it's easy to be like, oh, like, what is this plastic surgery? Like, who needs this? Until you actually feel like you could benefit from, or you experience it and say, wow, like, okay, like, whatever it is, I'm like 70, but I feel like I'm 50 because, and we can talk about this is like a huge space. It's like, okay, so like longevity stuff, we're living longer, healthier. So if someone is like 80 years old, there's nothing wrong with being 80 years old or whatever age, but many of us, if we feel like we're like literally like 2 decades younger, right? Because of how your work you've put in with exercise and nutrition, and you have a distractor that shows up. Let's say I saw someone today. Let's say she says, "Listen," she said, "I don't want to look like done, blah, like, but I do have this hereditary thing where we have this skin here, and I feel and look great otherwise, and I want to get rid of this because I feel like I'm literally too, it makes me appear in a certain way, and I get treated a certain way because of this." That's what she notices.
Yeah.
And so that's where I think this stuff comes in. People say, you know what? So my family has seen some of this, and I say, well, this actually is a very important thing, because we want to live our best life. Live our best life, Yeah,
so, and no, I agree. And people, I at some point in my career, I took a course on Botox fillers, and I was amazed as to the different people that came in. And why they wanted it.
We did a course you said injectables.
In Canada. Yeah.
Oh, wow.
Yeah.
I want to hear about this. That's cool.
Yeah, I did.
So you're in the space. I didn't know you were. You're one of us.
I was amazed, and some older women came in, and you're nearing the age of retirement.
Sure.
And you don't necessarily quite look like you're in your 60s, but on paper you're in your 60s, and they want to tweak a little bit so that they look younger, so they're not pushed out of the workforce.
Yes. Very, very important concept.
Had different reasons.
Yes.
I had a mom, she was an African mom of 12 children. You would never think, and you know what the cutest thing was? She would do it, and I said to her, "Do you tell your husband?" She goes, "No, each time I come back, he just looks, oh, you look beautiful." But he goes, "No," and she goes, "That's why I keep him around." So
yeah.
I mean,
yeah.
different. It's not all. Oh, I just want to look. However way people want to look, it's fine. But everybody's got their own reason, and it's their reason. And it's okay.
Yeah,
that's what I feel about it.
But even that's okay. If someone's like, "I just want to look like whatever,"
it's okay.
That's the beauty of it, And those who don't want to partake should not partake, and that's fine too.
That's fine too. So it's for everybody.
Truly, like a very democratic, open decision, and we embrace those who do come. We feel like we have the best practice certainly in Austin. We work very hard for our patients. We definitely work the hardest for our patients at 360. We really do.
Yes.
And we celebrate our patients. We do celebrate them.
I love something about your page. You don't call them patients. You call them guests.
Yeah. So,
I love that.
So I've thought a lot about, what term means what. And ultimately, someone who receives a service from me is a patient of mine. But not everyone receives a service from who comes into our doors, is the reality. You came into our practice today.
Guest.
you're a guest.
Yeah.
So, that we've belabored what term makes sense when, and there's no answer yet. But certainly, all comers who walk into our doors are certainly guests or patrons. And then if someone receives a service, then they become a patient of the practice. That's how we think about it now. So we left it kind of drastically open on the website in that fashion. But I think words do matter, and all touch points matter with aesthetic surgery, aesthetics, and so with plastic surgery, I think the way you think of, like, let's say a pair of shoes, let's say like some Valentinos perhaps,
The red bottoms.
or some Louboutins. So if someone gifted you a pair of Louboutins, like. And if I brought you some shoes and just gave you the shoes, you would say, "This is very nice, thank you very much, it's great," and you'd be happy with it probably. But if I came a different approach and I brought it, had someone come in with white gloves, and they came in a box with a bow, and they presented it, and there was music playing, same pair of shoes, but a very different impact. And so that's how I view what we do. I think that like a breast aug or a tummy tuck or a facelift is magical in its own right. And that alone could be great. But I think if someone walks into our doors, like the way they experience everything around that, including the phone call or the website thing or the post-op visit, the dressing removal, all that is a gift wrapping or an opportunity to gift wrap the procedure. And that is what we strive to kind of optimize at our practice.
I love that analogy.
And to celebrate our patients. I think that you can deliver this stuff in a way that's like, not empowering, right? When someone says, you can almost make them feel guilty or bad or less than or ugly even coming into your doors. You can that can be done with plastic surgery, or it can be done in a way that empowers and makes them feel beautiful. Someone was getting an injectable with me, and I was like, she was like, yeah, I didn't see that. So I was like, yeah, you're already beautiful. I think we can highlight a couple areas. So she goes, oh, no, you have to say that. Like, I'm here already. Like, you have to switch talk. So I was like, no. I was like, I honestly...
You wouldn't say it if you didn't mean. I certainly don't see things that I don't mean.
Yeah. Or more to the point, I feel like I see beauty in everyone, actually. It's a true thing. Like, there's beauty in everyone. And my job, unless someone tells me otherwise, when they walk in the door and I say, okay, what's beautiful here? And what am I highlighting here? That's literally how I approach the human face. Or breast, or body. And so that was what I tried to get across to her, and she thought I was trying to patronize her. But it's not the case. I was like, well, there's beauty here. I have this like in my hand. Like, how can I highlight cheekbones or chin or nose or whatever it is? I think that approach is to me, it helps me deliver what I feel like what my patients are looking for.
Excellent.
Yeah.
Awesome. Okay, let's do some rapid fires.
Boom. I'm ready. Should I hydrate again?
I think you should hydrate. I mean, all the time. Saline versus silicone.
Silicone, for sure.
Okay, we'll come back to that.
Sure.
Above or under the muscle?
Under.
Okay. Peri or infraareolar?
You mean like in the breast fold?
Yeah.
Yeah, in the fold. Yes.
Sorry,
inframammary.
Yeah.
Yes. Inframammary.
Inframammary? Okay.
Yes.
Motiva or smooth? That's a tricky question. I can see that you caught it.
Motiva or smooth? It depends, but if you gun to my head, smooth.
Okay, I love that.
We can explain that. We can talk about that. It's nuanced.
Okay.